All right, welcome to today's free webinar from Prevention Plus Wellness, located here in beautiful St. Augustine, Florida. It is an absolutely gorgeous sunny day. As I look out my window, it's 63. I think it's going to get into 70 today, so it's really nice weather, and I hope it's nice where you guys are at. And spring is on its way, so no worries. It's going to warm up for everyone soon. And my name is Dr. Chudley Wirch. I'm the CEO and founder at Prevention Plus Wellness, and welcome you to today's free webinar. This week, as you can see, marijuana prevention plus wellness. Next week, opioid prevention plus wellness. So that's what we've got scheduled for the next webinar, same time and same place, and we'll send out the notice of that. If you're not getting our notices on our webinars, go to our website, preventionpluswellness.com, drop in your email, and then you'll be notified of all of our webinars. So we've got 3 objectives today, and this is a webinar that we presented in the past, a similar webinar, but we've changed it quite a bit, and we have added a lot of extra resources for you. So those of you that are providers in the prevention, especially substance abuse prevention, mental health, health promotion areas, fitness, whatever the case might be, even parents, I think you'll find a lot of this very useful information. So 3 objectives. We're going to explore the contents and the components of the marijuana prevention plus wellness program. That's our program that we created. It's a modification, a spinoff, or an adaptation of the evidence-based SPORT prevention plus wellness program, which SPORT addresses largely alcohol. That's why we created, because providers like you asked us to create a marijuana version of SPORT. That's what this is, and it comes in high school, middle school, and elementary school versions. So you get 3 versions of the marijuana PPW program, just like you have 3 versions of SPORT. Then, secondly, we're going to examine the scripts and the PowerPoint slides used in providing the marijuana PPW program to youth individually, as well as in a group, in person and online. And we'll look at all of that today. And lastly, lots and lots of extra additional resources. I spent quite a bit of time searching and picking out some really good things that I think are particularly relevant to those of you that are in the prevention area. So not so much focused on treatment, more on preventing the onset of marijuana use among young people. So to start out, I came across this study that was just published last year on the significance of school-based marijuana use prevention. It was published in the Journal of Drug Issues, and this study looked at the impact of school-based programs, school-based activities, and thirdly, community-based activities on marijuana use among adolescents. It was a large sample, over 16,000 adolescents, and the authors concluded under number 3 there that adolescents are less likely to use marijuana if they participate in either a school-based program, school-based activities, community-based activities that address marijuana use. So you want to keep up, that's the good news. You want to keep up the good news. You want to present programs and activities in your schools, in your communities. And of course, if you've got evidence-based programs, that's even better, because then there's some evidence, some research, some support behind them being useful. So particularly pick those evidence-based programs to use in your schools, in your community. So there's the good news. That was a study just published last year. Today, we're going to focus on the marijuana prevention plus wellness program. There's a high school and a middle school and an elementary school version. So you can cover the whole range, almost the whole range of youth development with the marijuana prevention plus wellness program. So the marijuana PPW program, it's a single session screening and brief intervention practice, which is considered evidence-based. Screening and brief intervention is considered evidence-based by a whole bunch of organizations, including World Health Organization and NIDA and NIAAA and SAMHSA, et cetera. The marijuana PPW program, as I said, is an adaptation, or was created from the evidence-based SPORT PPW program. SPORT addresses alcohol, marijuana, PPW obviously going to address cannabis use prevention. Marijuana PPW addresses cannabis use, but also promotes physical activity in sports, breakfast and other healthy nutrition, sleep and stress control. And like sport and like all of our PPW programs, you present your lesson, show your slides, and you follow your script in your manual. Your physical manual includes a script to present your program to youth individually or in a group. And these are universal prevention interventions meant for all youth, whether they're in sports or not, or whatever, it doesn't matter. But some organizations throughout the country and abroad are using our programs, excuse me, for higher risk youth as a selective or indicated prevention intervention. So if you got kids that have been caught on campus using marijuana, for example, you can implement the marijuana PPW program to them, juvenile justice, et cetera, alternative schooling, so forth. Number 6, the marijuana PPW program is based on the behavior image model. That's a wellness-based model that focuses on providing positive images to motivate youth to want to avoid substance use and to improve their wellness behaviors, their protective wellness behaviors. Marijuana PPW comes with a digital download of all your reproducible materials, your slides, and anything you need to make copies of, so you don't have to purchase materials for your youth. And lastly, we have built-in slides so that you can present your marijuana PPW program virtually if you have to, because of the pandemic or because you want to reach more youth or whatever the case might be. So you got it covered. You can implement your marijuana PPW program to youth individually or in a group, in person or online. Very easy, single session screening and brief intervention. Okay. So let me just check here. I see a Q&A here. I want to make sure there's not a problem. Yes. Okay. So somebody's already on, Victoria's already on top of it. Yes, Victoria, you'll get a certificate for viewing today's session. You'll get a PDF of the slides that you're seeing today, because there's lots of links I'm going to give you today with lots of resources. So you're going to want that. So I'll send you the slides, and you'll also get a link to this recorded session. So no worries, Victoria, or any of you, you'll get all of these things. I'll send them to you later today. No need to reach out to me. If you're registered, you'll get these things. And because they include attachments, if you don't get them today, check your spam folder. Sometimes they'll be diverted to your spam folder because they include these attachments. So that's the marijuana PPW program. Obviously, that's what we're focusing on today. But guess what? I'm going to also mention the Sport Prevention Plus Wellness program. High school, middle school, elementary school versions. This is the program upon which marijuana PPW was built. Why am I showing the Sport PPW program, which addresses largely alcohol? The reason I am is because sport was evaluated and found to have an impact not just on preventing alcohol and tobacco, cigarette smoking, but also cannabis. So you'll see that the Sport Prevention Plus Wellness program, even though it doesn't mention or highly mention marijuana a bunch, it has had evidence of having an impact in preventing marijuana use. So that's why the Sport PPW program is listed on a whole number of evidence-based registries. In other words, we have research supporting sport as being effective in preventing cannabis use. And that's why we're going to be not just mentioning marijuana PPW, but also sport PPW, which is the basis for the marijuana PPW program. Okay, and you could read the rest of that there. And as long as I'm mentioning these things, why not mention the vaping PPW program that we offer? Vaping PPW addresses e-cigarette. It is also an adaptation from the Sport PPW program, but the vaping program addresses e-cigarettes. Now, why am I mentioning that here? Because there's a number of organizations that sort of lump these health concerns together. They lump marijuana use with vaping because obviously marijuana can be vaped. They sort of lump it in with vaping e-cigarettes as well. and they lump it in even with tobacco use. So sometimes you'll see organizations addressing marijuana and cigarettes and e-cigarettes. So that's why I wanted to just mention the vaping PPW program, which, like sport and like marijuana PPW, the vaping PPW program also includes a high school, middle school, and elementary school version. Lastly, I don't have a slide for this, but I did want to share with you that we do have an in-shape prevention plus wellness program, also evidence-based, also addresses mostly tobacco, but research on the in-shape program for young adults shown to prevent marijuana use and heavy marijuana use. So again, the in-shape PPW program also listed on evidence-based registries as a effective marijuana PPW program. So that's in-shape. Just wanted to mention that as well. So all of these programs, again, we're going to really focus on the marijuana PPW program from here on in. But the marijuana and all PPW programs include these components to them. You can see step-by-step directions for implementation, a screening survey, because these all PPW programs are screening and brief interventions. They have a screening survey. The marijuana PPW program screens for marijuana use, as you'd expect, but also the protective wellness behaviors, physical activity, nutrition, sleep. And that increases awareness for the young person about their health habits. So the screening is designed to increase awareness of your participating youth about their behaviors. Then you provide feedback. That's the second part of the marijuana PPW program. You provide feedback about those behaviors using positive image communications, eliciting unconscious images of youth in the future being more fit, active, healthy, successful, etc. That increases motivation for change. But then you'll also discuss, using your script in your manual, how marijuana harms achieving those positive behaviors and images. And then that increases motivation for change. And then you work on that change, you initiate that change by walking youth through a goal-setting practice, which includes avoiding cannabis and other drugs, and then increasing protective wellness behavior. So screening, feedback, and goal setting. That's why number 2, you have a screening survey. You have scripts for providing your marijuana PPW program in your physical manual to one youth at a time or to groups of youth. You have the colorful slides so that youth can see something while you provide this feedback. You have online and paper pre and post test surveys, a little bit more about that later. You've got an instructor survey, a little bit more about that later. Fidelity checklist. You've got an online version of the goal plan if you want to send that out to youth as an after lesson assignment. We always give phone and email support, Zoom support, anything you need to make sure you're successful implementing your marijuana or any PPW program. And we also have separate online training, a little bit more about that later today. So marijuana prevention plus wellness, like all prevention plus wellness programs, I've already mentioned this 3-step process of screening and brief intervention. Screen youth for the current health habits that increases their awareness of their behaviors. And you do this because it's sort of amazing how young people and adults, I would say too, really don't reflect on their day-to-day behaviors. And so this is a good thing for them to think about their health habits. Secondly, you provide that feedback that is designed to see themselves in the future being more fit and active and healthy and successful, and linking how, in this case, cannabis can harm those outcomes, those benefits, and those behaviors. And then thirdly, capitalizing on that increased motivation from those positive images and positive communication by helping youth initiate behavior change by setting goals to avoid cannabis and drug use and alcohol use and increase protective wellness behaviors. That's the 3-step evidence-based screening and brief intervention, prevention plus wellness process. So now let's take a look at actual content in your program manual and in the program manual and the program slides of the Marijuana Prevention Plus Wellness Program. We're going to focus primarily at the starting point with the high school version of marijuana PPW. Remember, there's also a middle school version and an elementary school version. I'll show you how these different versions differ, how they look, for example. So first of all, you're going to have an introduction, and your manual is going to have a script to help you with the introduction. Here it is. Here's a clip of it. And this is what you read. This is what you'll look at this. It's so brief, you'll have it almost memorized. You'll be able to really focus on your youth, whether it's that individual youth you're presenting this to or to a group of youth, and really focus on good presentation skills with a lot of motivation and enthusiasm, because this is, as all PPW programs are, motivational interventions. We want to motivate youth. We want to get them excited about improving their lifestyle by engaging in wellness behaviors and avoiding destructive behaviors, like in this case, cannabis. So you're going to ask them to take out their screening survey. You're going to have, this is the introduction to the screening survey. So remember, that's the step one, screening, feedback, goal setting. So you're going to implement the screening survey, and you're not going to collect the screening survey. It's for the youth. It's for their benefit. They could take it afterwards, throw it away, whatever they want, but it'll accomplish the goal of increasing their awareness of their health habits. So there's the script to implement the screening survey. Now, what are the items on the screening survey? For the high school version of the marijuana PPW program, these are the 6 behaviors that are assessed: physical activity in the last year, regular physical activity norms, breakfast and nutrition, sleeping 8 or more hours, and ever using marijuana. So for those of you that are familiar with sport, very similar to sport, because marijuana PPW is an adaptation of sport, but it's also different because rather than alcohol use under number 6, the marijuana PPW program is going to ask youth about their marijuana use. Number 3 is highlighted physical activity norms, because physical activity norms is a factor that's assessed and feedback provided in the high school version of marijuana PPW, but not in the middle school and elementary school version. So there are some differences between high school, middle school, and elementary school. And there are certainly differences between the marijuana PPW program and the sport program, which addresses alcohol, or the vaping PPW program, which addresses e-cigarettes, opioid PPW, which addresses non-medical opioid use. Okay. If you have any questions as we go along, if any of this is not clear, because I do talk pretty quickly, and I apologize, I just am familiar with this, and I do have a lot of slides I want to show you. Please do ask me a question under chat or under Q&A, and I will get to that question toward the end of today's session. So you've got a screening survey and a goal plan. You have options. You've got hard copies that you can actually print out from your digital download and hand out to your youth when you implement your marijuana PPW program to youth individually or in a group. But you also have in your PowerPoint slides, you actually have a link to an online version of the screening survey and goal plan. That's if you need to present your lesson virtually. So if you need to reach youth virtually because of the pandemic, because whatever the case might be, you can do that very easily. You just show your program slides. You can get your youth very easily, get your youth copies of a screening survey and goal plan. So you show your slides, kids click on the slides, opens up a screening survey, opens up a goal plan. They can complete it right then and there. So it works very, very well if you need to present your lesson virtually over Zoom or Microsoft Teams or whatever the case might be. So we got you covered. Lastly, there is, as I mentioned earlier, an online version of the goal plan. And some organizations, after they've given their marijuana PPW lesson or their sport lesson or whatever, they'll send youth the online goal plan link and give the youth assignment to do a second week goal plan, or they'll share that link with other teachers or coaches or parents and so forth. So that's just an optional online goal plan that you get with your marijuana and other PPW programs. So just to go back to review, so you've implemented, this is the script, you've implemented the screening survey, increasing youth awareness of their behaviors, health behaviors, and now you're going to present feedback. And you're going to present feedback following the items on the screening survey. These items here, starting with physical activity in the last year, that's number 1. So there it is, there's a sample, there's the script, and you'll have in script things in brackets, which are actually directions. So show slide, ask your participants in your classroom. This is the group script, so you're presenting this to 2 or more youth. Ask them to raise their hands as you go through each of the physical activities on that first item on the screening survey, which is what sports physical activities did you do in the last year. There's even a slide that restates that. And so you go through this long list, did you ride a bike? Did you walk? Did you play, soccer? Did you dribble a basketball, etc.? Did you work at home or was for someone else? And you'll see a lot of hands raised, and that sort of supports the social norm. My friends, my peers are physically active, which is a very positive social norm. So that's the feedback. That's how you present your feedback. Also, you'll continue by highlighting the benefits of that wellness behavior. In this case, it's sports and physical activity. In the last year, after that, it's regular sports and physical activity. After that, it's breakfast, and then it's sleep, and so on. But you're going to highlight the benefits of those wellness behaviors. And here's your script. Good for you. Sports and physical activities are a great way to get regular exercise. Sports and physical activities are fun. They help you look fit and strong. They help you feel good about yourself and give you lots of energy that can help you do better, even in school. So that's your script. Notice I altered it a little bit because it just sort of flowed nicely with the way I was speaking. Lots of enthusiasm and passion. Look at those image terms, fit and strong, very positive. That brings up unconsciously images in the mind of youth in the future. And we want our kids to be fit and strong. They want to be fit and strong, and that increases motivation for change. Now, that's the benefits of the sports and physical activities. There's the slide even. You're going to show it. Notice you're going to have the fit and strong there. There's the words and fun and energy and feel good about yourself, all those things. And you got images that are representative of youth. You'll have both genders, different ethnicities, different activities, very, very positive pictures. Then the second part of that feedback messaging is going to be how cannabis harms sports and physical activity, or harms regular physical activity, or harms eating breakfast and healthy foods, or harms getting sleep. And here's your script. However, marijuana and active lifestyles simply don't mix. In fact, using marijuana can hurt your health and affect how well you do in sports and physical activities. Using cannabis can harm your brain development. It can harm your lung function, and it can increase risk for mental health issues that can hinder you from being, or stop you from being, successful in school and in sports. See, that's how we link these messages. They're very, very succinct, but very powerful, very direct, very clear. And you're just showing to youth, here's how marijuana is really going to interfere with these positive behaviors that would really benefit you, because they would provide you with so much great outcomes, including improved self-identity. And then there's the slide. So you can, for the visual learner, you got the slide, you got the images, you got the keywords, and you want to show lots of representations of your population. And that's why you're showing these slides. So then you continue with the feedback, and then this feedback follows the schedule of the screening survey. The second feedback item is going to be on regular physical activity, then physical activity norms, then breakfast and sleep, and then cannabis use. When you get to cannabis use, you're going to address more content, because you're going to want to address other risk and protective factors known to influence cannabis use. So The content in your marijuana PPW program will be this here on the right. You're going to discuss with following your script, showing your slides, how marijuana, that's MJ, can harm your fitness and health, can cause life problems, myths associated with marijuana use. Most youth do not use marijuana, which is a social norm correcting message. Healthy alternatives to using cannabis. Choose for yourself, plan ahead, and recommendations for increasing wellness. All of this content you'll be presenting as feedback to your participating youth. Okay. And then you'll get to your recommendations for increasing wellness. That's that last item right there in the bottom of that feedback, recommendations for increasing wellness. And so look at all of this. Look at number 5. Of course, you're going to recommend avoiding marijuana use, but then you're going to broaden that message to include other substances that can interfere with you having a healthy lifestyle and a successful lifestyle and feeling good about yourself. That includes alcohol, tobacco, e-cigarettes, prescription drug misuse, illegal drug use, and also at the same time, items 1 through 4. Number 1, getting plenty of sleep. It could be 8 hours or more a night. Number 2, eating a healthy breakfast, so essential to energy and performance, but also eating other healthy foods, especially fruits and vegetables, which are really greatly missing in the dietary practices of most adolescents in the United States and abroad. Participate in plenty of physical activity. The goal really is 1 hour every day as a minimum. And we've even added to that practicing stress control or relaxation. Now, if the youth is getting plenty of physical activity, if they're getting plenty of sleep, if they're eating healthy, those are all very important stress approaches, stress control approaches. But there's other things as well. You can see them here: yoga, meditation, and prayer, and nature, etc. So you're going to give youth lots of ideas there for how they can improve themselves in these 4 critical areas: sleep, physical activity, breakfast and nutrition, and stress control. So those are the recommendations you give to your youth individually or in a group, depending on whether you're using the individual script or the group script. Built within the slides, we have these discussion questions, and they have a twofold purpose. The first is to get youth to continually reflect on how this content relates to them and their lifestyle. So, for example, when you provide feedback on breakfast and nutrition, the question is, what types of healthy foods do you like to eat, or would you like to eat more of? And you're going to pause and let them think about that, reflect on that. And if you have time, when you present this individually or in a group, you can get some feedback from some of your participants if you have time to do that. But the key focus is to get them to think about themselves. The second focus is to have group interaction when you present this, and if you present this in a group format. So that's why we have discussion questions. That's the end of the feedback. So remember, you screen youth for the current health habits in the marijuana PPW program. You've provided feedback on all the healthy behaviors and cannabis youth. And now that third step is they're motivated, or should be motivated at this point, to change their lifestyle, to improve their image, to improve their functioning and their success. Now you're going to give them an opportunity to act on that, to initiate that behavior change through this goal plan contract. And PPW goal plan contracts have these components. Number 1, recommendations for wellness. I already showed you those that you present to your youth. Number 2, a pledge or a selection of a list of substances to avoid in the next 7 days. This is a very short-term 7-day goal plan. And so that certainly in the marijuana PPW program is going to include marijuana, but of course, other things too, other alcohol and other substances. Number 3, you're going to help your participating youth write a measurable, achievable wellness goal to increase one of those 4 wellness behavior areas: sleep, physical activity, nutrition and breakfast, or stress control. they're going to sign and you're going to co-sign it, making it a contract, increasing motivation for change, very important. Number 5, there's a monitor, a 7-day calendar log to monitor the behaviors. They're going to take their goal plan home, post it, and track their behaviors for the next 7 days. Did they achieve their goal on any of the next 7 days? And then lastly, built within this goal plan, very important congratulations and instructions and support and feedback to youth about how to continue the process of goal setting and improving how they feel and about themselves and improve their healthy lifestyle. Okay, that's all on the goal plan contract. Now, a question might arise, how does the individual script, if we present this to one youth at a time, differ from the group script, which we just looked at? So the individual script, and this is a version of it, the Marijuana PPW high school version, individual feedback lesson script. You're going to present this feedback, you're going to present your lesson to one youth at a time. So you'll sit across the table for them in a private or semi-private area because you are talking to just that one youth about their health habits, including marijuana. So you want to have some privacy there. The difference between the individual and the group script is primarily this. You're going to see how they answer to each of those screening survey questions, and then you'll pick a response based on how they answered. So as you can see here, this is a marijuana use. You read one response only. And the feedback here is on marijuana use can harm your fitness and health. If they said no, they didn't use any marijuana, you'll read the no response. No is highlighted in green, good, go. It looks like you have not tried marijuana. That's terrific. And so you can see you're just providing them, you're recognizing their where they're at with their behavior, and you're providing positive feedback. Let's say they said they did try marijuana, and then what you'll do is you'll read the yes response, which is highlighted in red, which is warning or higher risk. And here's the response, here's the script. I see that you may have tried marijuana, and active life and cannabis do not mix. So the most important thing you can do to be healthy and to maintain an active, healthy lifestyle is to stay away from marijuana use that can harm your health and your fitness. So that's the difference, either positive feedback, good for you, congratulations, or neutral feedback, nothing negative, because if you provide negative feedback, if you accuse them of using something, if you're going to be heavy-handed like that, which is not uncommon for us to do as teachers and parents, but the problem is youth tune you out. They don't listen to you then. So the scripts are either going to be providing positive feedback or neutral feedback. Positive, good for you, or neutral, it looks like you may not be doing the best thing. Here's an opportunity for you to become even better in your lifestyle practice and feel good about that. So that's the difference between the individual and the group script. Any questions about that? Let me know, and I'm happy to answer any questions you might have. Now, how does the high school version differ from the middle school version of Marijuana PPW and the elementary school version? So I just wanted to show you just 2 slides just to give you a real quick difference. Obviously, one of the main differences is the images that you see in the slide. So this is the elementary school version of the Marijuana PPW program, I'm sorry. And as you can see, it looks quite a bit different from the high school version, which has older adolescents. Elementary school version has these beautiful, cute kids. And so they can see, again, models or representations of themselves. Sometimes the content's a little bit simplified as well. That's important. And then sometimes the content's a little different, as we said, between the high school and the middle school and elementary school version. So there's just an example of the elementary school version, benefits of sports and physical activities. Here's how marijuana can harm your benefits. Being physically active harms your brain and your lungs and how well you do in school and sports. But look at those beautiful images of those kids, and very diverse kids, having fun, healthy, happy, but quite a bit different than the images in the high school version. Obviously, high school version, older adolescents, elementary school version, elementary school age children. So just wanted to show you that, a little bit of difference there. Evaluation materials built in all the PPW programs, including the Marijuana Prevention Plus Wellness. You get pre-test and post-test survey to assess outcomes, instructor survey to assess the quality, process measure of how well you're implementing your program across time, and a fidelity checklist to assess fidelity. Your pre-test, post-test surveys, we have an immediate pre-post survey, which makes it very convenient for you to assess changes in risk and protective factors, behavioral intentions, perceived harmfulness, social norms are the three main measures. And you can do that either with a paper and pencil survey, or we can give you a customized link or QR code, and the kids can just click on it, open it up, fill out the survey. You launch your lesson, show them the post-test link or QR code, they fill it out, and you're done. So if you can, we're trying to make this as absolutely easy and possible so that you as the implementer can get this incredible feedback that you need and deserve to promote your program and to improve your program over time. So you've got a pre-test and a post-test in an online version or in a paper version. And then we also have now a health behavior survey, which measures not just behavioral intentions, perceived harmfulness, and social norms, which are risk and protective factors, but the health behavior survey measures 30-day behavior use, 30-day substance use, marijuana, alcohol, opioids, e-cigarette, et cetera, and 30-day healthy behaviors, physical activity, breakfast, sleep, et cetera. Now, if you want to use that, we can give you that health behavior survey link and an online version. It's just that when you do the post-test, you have to follow up with youth at least 30 days after your marijuana PPW program, because it's measuring 30-day measures. So the health behavior pre-post-test survey requires that you come back and measure post-test at least a month after you've implemented your marijuana PPW program. Make sense? Do you have any questions about that? Let me know. The instructor survey process measure, really important, is for you as the instructor to complete at the end of every one of your lessons, and that's to assess how well did you implement your program. So for example, number 4, what was your level of enthusiasm and passion? We want you to be in the high level, because that's very important. And so you assess yourself, and you can do that at the end of every presentation of your marijuana PPW program, and you could track your quality of implementation, which is likely to change over time based on the individual or the group you're presenting it to, the situation, how you feel, et cetera. So that's why this process measure, very important. And it does indicate how well or the quality with which you present your lesson to your individual or group of youth. We have training opportunities online and in person. You can be trained as a program implementer in the marijuana PPW program. You can be trained as a trainer to train other implementers. We have self-paced training now for implementers, and we have online training for train-the-trainers, and we can also train your group in your setting, depending on the COVID and how safe things are at that particular time. But we've a lot of flexibility with training for you as the provider. And all of our programs are listed here. I think most of them are here at least. SPORT, that's the Alcohol Drug Prevention Plus Wellness Program. We mentioned vaping PPW, e-cigarettes, marijuana PPW, opioid PPW. In Shape is our young adult PPW program. SPORT 2 is our only multi-lesson program. It has 6 lessons. We have a new racial justice program. We have parent programs where you can train your parents in one session to provide the same positive image communication and goal setting at home that you present to your youth. So we have a parent program for sport, parent program for marijuana, parent program for vaping, et cetera. So that's a relatively new addition to our programs, parent PPW programs. And we have a free In God's Image spiritual-based program. Now, lots of extra resources. I'm going to go through these quickly. You can look at these on your own. I'm going to send you the slides. Some of you, I'm sure, have heard of SAM, Smart Approaches to Marijuana. And that's an organization you may want to check out. You can see number 3, their mission is to educate citizens on the science of marijuana and to promote health first, smart policies and attitudes that decrease marijuana use and its consequences. And I would say especially essential in the case of young people, okay? That's children through young adults. So because even in states and nations that allow marijuana use to be used either for medicinal purposes or for recreational purposes, it's limited to adults, okay? Normally that's 21 years of age. I think Canada is 18, but still we all want to prevent youth from using marijuana and other substances until their brains are fully developed and they're older. Let me see, I can't see, preventing marijuana use among youth and young adults. This is from the DEA, Drug Enforcement Administration, almost forgot what it was. The DEA, obviously, they're really focused on enforcing laws. Of course, nationally, the law is marijuana is illegal. So it's just that we have this crazy patchwork now where we have states where it's legal either to use for so-called medicinal purposes or so-called recreational purposes. But the DEA also has content on their website, and there's a link at the bottom of this page about the dangers and consequences, particularly of using marijuana use. So good content there, I think, that some of you might find useful. Preventing marijuana use among youth. This is from the Substance Abuse Mental Health Services Administration last year. It's a guide to literature about marijuana use and youth. Good content there. A list of evidence-based programs effective in preventing and reducing marijuana use in youth and young adults. This was initially published in 2013. It does include a SPORT, Prevention Plus Wellness, as an evidence-based program for preventing and reducing marijuana use. This is out of Washington State Department of Social Health and Services that really leads the way in a lot of content. Of course, Washington State was the first state that approved so-called recreational marijuana use in the nation. Updated inventory of programs for preventing and treatment of youth cannabis use, published in 2017, also from Washington State Institute for Public Policy. This includes both in-shape and sport prevention plus wellness as evidence-based programs on that list. It's a broader, larger list. Health and social effects of non-medical cannabis use from the World Health Organization. And so this is, I think, an interesting world view with, well over 180 million people throughout the world using marijuana use for non-medical reasons. So it's, again, the most commonly used psychoactive substance under international control. Marijuana drug facts from National Institute on Drug Abuse. That's a good link there to read more about marijuana use. Here's one from CDC, Marijuana and Public Health. Some good content there on their webpage. Prevention programs that address youth marijuana use, again from SAMHSA. And this list includes SPORT, Prevention Plus Wellness, as an evidence-based marijuana prevention program. Marijuana use and illegal drug availability from the National Center for Education Statistics. Essentially, this is a snapshot of the Youth Risk Behavior Survey data in regard to marijuana use. You can also just go to Youth Risk Behavior Survey or CDC and get these data as well. It's on middle school and high school marijuana substance use. Cannabis, public policy statement from the American Society of Addiction Medicine, 2020 is good content there, lots of good content about cannabis use from Society of Addiction Medicine. Action needed, youth and marijuana from the Truth Initiative 2019. So the Truth Initiative really focused initially on tobacco use among youth, with their goal really to have youth not, use tobacco. They've expanded that messaging to not using marijuana, not using e-cigarettes. And so they have a policy statement. I think you might find that useful for yourself and for your youth and for families and for teachers and coaches. And that's the youth, that's the Truth Initiative. Know the risks of marijuana, again, from the Substance Abuse Mental Health Services Administration, a webpage content there. Preventing youth marijuana use programs and strategies from Prevention Solutions includes lists of evidence-based programs for marijuana prevention, including InShape and SPORT Prevention Plus Wellness. So you get all kinds of evidence-based registries or listings. Marijuana Prevention Strategies, Resources Guide from Prevention First, 2019. And so this had some good content. This is out of the state of Illinois, but I thought it has content that's relevant to wherever you may be. So I think it's a good guide. So that's why I'm sharing it with you. Another best practice program descriptions for youth marijuana use prevention outcomes from ADAI Clearinghouse. This includes evidence-based programs, including SPORT PPW is listed on it. Cannabis/marijuana awareness toolkit from Stanford Medicine. A lot of good educational materials on this website. Strategies and interventions to prevent youth marijuana use, an at-a-glance resource tool from SAMHSA again. And on this list of evidence-based programs is InShape and for young adults and SPORT for youth prevention plus wellness. Youth marijuana prevention toolkit, a guide for parents, teachers, and adults. This is created by King County Public Health out of Washington. Washington, I think, was maybe it was the third, what did I say? First state where there's some legal so-called recreational marijuana use. So good content here. So I wanted, even though it's out of Washington, I think relevant for across the nation and even world. And similarly, a higher education cannabis toolkit for those of you focusing on higher education. This comes out of Coalition of Colorado Campus Alcohol and Drug Education in Colorado was the second state in the U.S. to approve of so-called, I keep saying so-called because of the terms recreational marijuana use. So good toolkit for those of you working college campuses. Colorado Retail Marijuana Education and Prevention Resource Guide, and more good information from out of Colorado. And that's relevant, I think, for everybody who's interested in marijuana prevention. And I'm going to stop at that point. If you want to learn more, you can look at our catalog of programs on the left. On the right, you could click and ask for a sample of the marijuana PPW program or any of our PPW programs. Just make sure you request what version, high school, middle school, elementary school. You can reach out to us anytime at info@preventionpluswellness.com. Call us on our phone here in St. Augustine, 904-472-5022. Do go to our website, preventionpluswellness.com. We've got a lot of free resources on our website. And you may want to drop in your email so that you're on our email list for our next and subsequent webinar. So thank you so much. I'm going to pause it this time. I'm going to thank you for all you do, as I always want to do before you go. God bless you for the work you do with youth, for families in your region. In this case, very popular topic, marijuana, cannabis prevention. But there's a lot of resources out there. You saw that's sort of like the tip of the iceberg. There's so many things probably from your state, your region, locality. But I tried to cover as much as I could in terms of especially the national resources for you and for focusing on prevention. Now, let me see if any of you have any questions or comments that you want to share with others. And I'm going to go to the, let's see, I'm going to go to the chat space. I'm going to back up so I don't see miss anybody. People are introducing themselves. Thank you. You're welcome. Thank you guys for all you're doing. You're doing the hard work and the important work. So yes, one more time, just so that, again, nobody misses this. Everybody who's registered will get a copy of these slides. That's one. Number two, you'll get a link in my email to you with this recorded webinar. And then thirdly, if you've watched the webinar, you'll get a 1-hour CEU certificate for the time you've spent. So you'll get that. I'll send that out to everybody. If you don't see it in your mailbox, in your email, then check your spam, because it has attachments, and sometimes because of the attachments, it'll be routed to your spam folder. So no need to ask me for it. Everybody who's registered for today's session will receive an email from me. Okay. So thanks for that question. Great information. Thank you. Thank you. Thank you. Thank you. Great job. Love the information. Thank you guys for your generosity and your many thanks to me. It's my great pleasure. That's about it. I'm going to wait just another few seconds to see if anybody else wants to say anything, if there are any questions. Was there anything unclear? So you got a lot of options here for evidence-based programs. You can use our evidence-based sport or in-shape prevention plus wellness programs. You can use our marijuana prevention plus wellness program, which, while it hasn't been individually evaluated, it is still an evidence-based screening and brief intervention practice. And it is an adaptation of the evidence-based sport program. And if you want to address marijuana content, the marijuana PPW program is a great program to do that. Very, very efficient, very practical in a single session screening and brief intervention. Will the marijuana test be in the slides? Whatever the slides show, you'll be able to see. I don't know about the test, but and Tony, in terms of test, not sure what you're after. You're talking about the pre and the post survey. The pre and post survey, if that's what you're talking about, Tony, let me just tell you this. You can go to our website, preventionpluswellness.com, and go to resources and evaluation. So preventionpluswellness.com, resources, evaluation, and then if you scroll down to the bottom of the page, you'll see samples. You could actually see all of our surveys and data collection tools are there, so you can check those out. If you're talking about the screening survey, the slides did cover that. Okay, so I think we got you covered there, Tony. All right, I think that's, one more question here, one more comment. Yes, that's what I was talking about. Okay, thank you guys. Again, stay safe, take care of yourselves. My heart goes out to you because of the challenges you face as educators, as professionals during the pandemic, but take care of yourselves. Please keep doing the good work you're doing, because youth need you. They need you to support them, and they need you to promote their whole health, not just avoid substance use like cannabis, but to improve those very important protective wellness behaviors, which they're lacking too. Physical activity and sports, breakfast, nutrition, sleep, stress control. Anything you can do by using our programs or others, please do it. Okay, have a great day. And hopefully I'll see you next week for our opioid prevention plus wellness webinar. Thanks, everyone. Bye-bye.